right, so let's get started for Nurse Digest. Thank you to everyone for joining Nurse Digest. This is the final of our series for 2020. My name is Margaret Dempsey from APNA. APNA, along with the Australian Digital Health Agency, respectfully acknowledge the traditional custodians of the lands across which we meet and pay our respect to their elders, past, present, and emerging. I'm speaking to you from Wathaurong country today in Victoria. Through this series of Nurse Digest sessions, APNA and the Digital Health Agency have delivered education focusing on viewing, uploading, updating information, data quality, and using the My Health Record system. And today we're handing the reins over to you. During this session, you can ask questions about My Health Record, and we'd also love you to share any practical tips or handy hints. So our panel today consists of Carey from the Digital Health Agency, Karen Booth, who's our President of APNA, and also joining us is APNA member Helen Curtin. Helen has worked as a primary healthcare nurse for 11 years, and we thank you for joining us today to share your My Health Record experiences. So welcome to all the panel. A little bit of housekeeping. Please type any questions for the panelists in the Q&A section. So not the chat, questions for the panelists in the Q&A section. You can share any stories or comments into our chat box. And also remember that presentation slides and recording of this event will be available following the session. So let's get started, and over to you, you can ask away. To begin with, I'm going to ask Helen to introduce herself and share an example of where My Health Record has benefited her patient care. Welcome, Helen.
Thank you. I've spent 10 years as a practice nurse in a 14 GP practice with 4 nurses, and now I'm the solo nurse in a 6 GP practice. I was suburban and now I'm in the city. So I used to use it a lot for the grey nomads, our patients who are off travelling, recommended it for them. But now we mostly have scooter accident victims come in. So they're patients who just walk in bleeding, and we need to know when their last tetanus was. So I always just say to them, would you give me permission just to look up your My Health Record? And they're, I don't know, astonished, confused. Because I tell them that's where I'm going to be able to find out if you've had a tetanus. So that's mainly the uses that I'm using it for.
Sounds a perfect example of how My Health Record system can benefit us all. Thank you, Karen. I'd also like to introduce Karen Booth and ask Karen to comment on the value of My Health Record to nurses and APNA's position on that and commitment to digital health. Welcome, Karen.
Hi, everyone. Look, I would highly recommend regularly in practice. And when we were looking at this session and the types of examples we might talk about, I have 2 favourite patients that come to mind. One of them, they're brand new to the practice. They're brought in by their son. The lady was 94 years old and her husband, who I described as a toy boy, was 90 years old. And their GP had just simply closed the doors. No forward acknowledgement that the GP was retiring, and there was no way that they could access their medical record. And they had run out of prescriptions and they had medications due, and they both arrived as brand new patients to the practice. And we spent some time working, the GP and I, interviewing them, trying to work out what their medications were, but they didn't know the names of all of them. And as you know, particularly old people often just, their doctors prescribed it and they're very compliant and they've taken their medications. They know one's for blood pressure and one's for something else, but they're just happy to take it. And the only link we thought we'll try their local pharmacist. And fortunately, they also had a regular local family pharmacist. So I called the pharmacy, and the pharmacist wasn't there, and ongoing history. So we had a few torn cardboard boxes, still an incomplete list, trying to talk through medical history. And the son said, I think they've got one of those, you know, those record thingies. And I said, you mean the My Health record? And he said, yes. So we're able to make them live on our computer system. And when we opened it up, there was their medical history, there was their medication history, and their dispensing history was there. So we were able to then look at the type of prescriptions they needed. We knew exactly where their medications were up to, and we were able to enter that into our regular medical record. And we knew that eventually this couple were going to transition into aged care. So we were able to make sure that we could upload it. So when they did move to aged care a few months later, that was there, again, very easily accessible for the team in an aged care facility. Uploading and noting records for information, like referrals to the My Aged Care website is also, that's also really handy. That facility is really helpful. So I recommend it to everyone. And I look at my own My Health record and I can look up, oh yeah, that's when I had my last, script done, or that's the last, old lady pathology that I had done. So very easy to follow that type of information up. So yes, I think the My Health records are a winner. So did you?
Thank you, Karen. That's such a great example.
If you like, I can just add.
Yes.
Yeah, I was going to say I can also. Did you want me to chat about the APNA modules or?
Yes, please.
Okay, so there are on our website. I can also recommend the APNA modules, and I like the fact that on the website the two modules, in an opening recording, it looks at how this fits into your career pathway. You'll get a certificate when you finish the APNA modules that you can then look at how you tick that box and how that fits into your professional development, as well as giving you that, a better understanding of how to navigate the record.
Thank you. Yeah, thank you, Karen. There's a little slight delay in sound, so we just need to be aware of that. I would also now like to introduce and thank Carey Doolan from the Australian Digital Health Agency for joining us on the panel. So Carey, I'm sure that you'd like to add a comment. Well, I'll firstly remind people to please put any questions into the Q&A section at the bottom of the screen.
Yeah,
Welcome,
thanks, Mark. And I'd be interested to hear from everyone on the line as to, have you used My Health record, and what have you found in there? Has it been of value? So yeah, it's been fantastic working with APNA over the last 6 months or so. We have been working together on this Nursing Digest and community of practice, which has been a fantastic thing. And I'm so impressed with the number of people that have engaged with it and asked questions and continue to be a part of it. So I'd be very interested to also hear from the audience what their experience of that has been, and would you like it to continue? Other than the APNA work, we do work with a range of peak bodies, but also we are providing a range of education through our Digital Health Agency website on our events page, including some very detailed clinical examples of how to use My Health record in clinical software using our what we call on-demand sessions or on-demand training environments. So that they are short sessions that are available through our events page as well. We have educated about 18,000 people this year, which is about double the number that we presented for last year. And so I guess that gives you a bit more of a feel of how much digital tools have played an impact during our COVID world over the last 6 to 9 months. So it's been fantastic to participate here. Thank you so much, Mark.
Thank you, Carey. I do have a question that's come through. How widely used is the My Health record used by nurses in the hospital or in outpatient departments? I think that's significant because we do want to know how well they link with us working in primary care.
Yeah, I'd be interested in Helen and Karen's observations in regards to nurses in hospitals and outpatient departments. If Karen or Helen have had any experience talking to those areas before, but we hear from there, as you probably know, there's hundreds of thousands of people that work in hospitals and outpatients, and so it's a big area to move forward in a uniform way to start clicking on that little button for the My Health record. We hear a lot from nurses in hospitals that they've clicked on the button and there wasn't much information there. Perhaps they clicked on it several years ago when the education and the communications went out to alert people about it. And at the time, it was early in the days of the system going live and there wasn't a huge amount in there. Now that we've got over 90% of the Australian population with a My Health record, the likelihood of information being there almost every time is very high, particularly the Medicare history. Medicare information is significantly where we can find at least a little bit of information. So we do hear of nurses going in there and saying, there's not much in there, I can't see any GP stuff. We also hear of general practice going into My Health record and saying, oh, I don't see a lot of other stuff in there from time to time. So the more we upload, the more information we put in there, the more useful it is each and every time. But are nurses using it? Absolutely, in hospitals and outpatients. There are a lot of nurses jumping in for viewing the medicines history and hospital discharge summary history. Nurses on borders where the hospital might be, say, in New South Wales, but the nurse is in Queensland, seeing that past history from other regions. We are hearing more and more that they are seeing the shared health summaries and the event summaries that you've been uploading into My Health record, and that's hugely valuable. Every time we talk to a hospital clinician about finding general practice information, it's like gold, and it really is well appreciated by them. So we're seeing a real upsurge of information going up, and as we see that, it just becomes more and more useful.
Thank you. So Helen or Karen, do you have any comment regarding that? Have you had any issues with accessing information like through the hospital sector?
It's Karen here. Look, I think it's still, even though the My Health record has been going for some time, it's still early days for hospitals using it. And I think if we look at the type of activity that's been happening in hospitals, computer-wise, a lot of them have put in fairly new electronic medical records for their own systems. Some of them are still coming up to speed with that. Some of them, I think, still don't quite understand how important it can be for after hours and in the community, that information. Having access to electronic discharge summaries through the My Health record is a very exciting potential consumer demand. And I think the sooner or the more consumers that are getting used to looking at their own version of their record, they'll start asking for that information. And I think we really need to push that with consumers, or say to them, have you opened your app? Have you registered for your app? And did you know all that information that you always thought was secret squirrel doctor's business, you can read that in your record. And they'll start to, I think, to drive that demand. It's usually what's happened in everything else health, is that once the consumers drive that demand, everything picks up.
Thank you, Karen. And Wendy's made a comment that the hospital staff phoning the clinic for patient information, current medications, and if only the hospitals were getting on board. So I think we agree that there's it's, you know, as primary care healthcare nurses in that general practice setting, we've got a really big role to play, and we can start helping the consumers drive it, just like Karen was saying.
Yeah, good point, Mark. A lot of nurses do say, you know, the patient saying, you know, I've got a My Health record, like Karen's example. I've, you know, the people said, oh, it's My Health record. We've got a question about the patient. We've got something, that information that we don't have in front of us, whether it be pathology or medicine's history or hospital history. Let's think My Health record and click at that point. And patients talking about their My Health record will certainly assist in driving that. Having said that, across the country, you know, there are some states with public hospitals that are automatically uploading their hospital discharge summaries in droves. And also private hospitals. So about 95% of public hospitals are connected to My Health record, and most of them are uploading hospital discharge summaries. 67% of private hospitals are connected, but about 50% are uploading. So we do hear as well from some practitioners that they're more likely to see a discharge summary and a My Health record than through secure messaging into their inbox. But yeah, as we talk more about it, everyone will gel with that.
Quite true. I've got a question here. I'm going to ask Helen to provide some input, but also Carey to provide it. It's Helen, do you use, what software do you use?
We're using Best Practice.
Best Practice, perfect. So this nurse has started working in a private general practice, and an RN is mentoring her in this role and has not mentioned My Health record since she started. And she's actually tried to look at My Health record in Best Practice. However, the tab is greyed out. So Carey may pick up on that. But she's spoken to the practice manager, and all the doctors, they said all the doctors should be using it. So she's slowly learning about it, but probably needs further information. I know, Helen, you've been following the Nurse Digest sessions and then going back teaching your your GPs, haven't you?
Yeah, I have, because I found the Nurse Digest sessions much more useful each month. Really useful, because Carey does it on the screen. So it's really helped me.
Great, thank you. And Carey, can you provide a comment on why the tab is greyed out, the My Health record tab?
Yeah, given the practice manager said that all the doctors should be using it, it sounds like the nurse hasn't been set up for the access. So the organisation or the practice needs to be set up by the practice manager together with, say, Best Practice or medical director or the software provider. They need to have the certificates in place and the HPIO in place. So that's an organisation practice level management done. But then each individual clinician, including the RN or nurse, needs to have their access set up, and it's just a little user preference or user setting that's set up, and practice managers or staff can contact their software provider for assistance in understanding where to click to make that happen. But it's good to know the doctors are using it, but yeah, as indicated, we'd really recommend that all clinicians are getting some benefit out of viewing bonus health information in the My Health record.
Sounds perfect. Thank you
Carey,
very much.
Carey, is it also on the demographics page above the Medicare number that we have to make sure there's a HI connection?
Yes, good point. Now, yeah, good point, Helen. So that particular patient might be a patient without a My Health record, or that particular patient might not have had a match of their IHI, which comes through having a Medicare card number or DVA card number, plus date of birth, gender, and Medicare number, gender, date of birth, and name matching.
Yeah, because I had found that greyed out section instead of the little green My Health record. It had been grey.
There we go. Well, we hope that's solved an issue for that nurse. Karen wants to make a comment.
Yeah, please, Mark. Look, I think there's still some misunderstanding out there with practice managers and some doctors about who can access and who can upload. And it may be that for this particular situation, it's the practice that is, and the manager going, actually, no, it's just a ticker box. I've done it in Medical Director for whole teams where you enable them to have access to the My Health record. So if it is an issue, and if there's multiple nurses having the same problem, it might be we just need to have a chat with the Practice Managers Association and say, actually, did you know, and here's the most that nurses can do this, here's the most up-to-date information. So if it was a wider trend, we would look at trying to follow that up and correcting that misinformation.
Yeah, and that'd be a fascinating conversation, Apna, talking to AAPM on that. And yeah, we'd certainly welcome the merrier talking that through. Another interesting piece of feedback that we've received from nurses over the last year or so is that there's still a bit of a practice of getting consent from patients before viewing or uploading to their My Health record. And I'd be interested from the audience whether that is the case in your practice. But just to put that straight is that you are authorised and in fact encouraged by law to utilise My Health record for the benefit of patient care without explicit consent. And you are authorised to upload without explicit consent. But of course, certainly do check in with the patient as to whether they're still taking their medicines and whether the content is up to date. But yeah, you are authorised and okay to upload and view without explicit consent. And that goes for RNs and ENs. ENs can upload an event summary, not a shared health summary. So thanks for that, Mark.
Thank you. Helen, one of our attendees is saying that their GPs just haven't embraced using My Health record, and she's not sure as a Div 1 in her role about using it. And can you clarify what a registered nurse should do in regards to using My Health record when the GPs aren't really on board? Do you have any tips about, are the GPs within your practice using it on board? Because as I said, I know that you watch the Nurse Digest sessions and then go back and do some training with them and get them on board.
Yeah, the one-on-one training with the doctors has actually really helped them to use it or to come back and ask me another question about it. I've been using it for ages, and I've also been using the health provider portal as well as AIR. So I can go in from lots of different angles, but I think it's just the one-on-one that's really helped them. The practice I'm working in now only has one older doctor and all of the rest are younger. So I think that also helps.
And I know that Carey gives comment about a GP that he spoke to who says it's such a time saver. So the actual value of having information in that My Health record is such a time saver in being able to access information that's perhaps the key selling point for GPs.
Most definitely. Yep.
Thank you. I've got this couple more questions. So I'm going to ask Carey, we have covered this in previous Nurse Digest, but about uploading pathology. And does all the pathology get uploaded? And do all the GP records, are they automatically uploaded, or do they have to actually be manually uploaded?
Yeah, so whenever if you forget what I say now, that's fine. We've got a myhealthrecord.gov.au website where you can ask these questions in the search field at the top right, and you can find out which hospitals and which pathology organisations are uploading or have the capability to upload to My Health record, and that's private and public. So on pathology, there's automation to get pathology up. Most states and territories have public pathology going up to My Health record. What's taking place is a rollout of private pathology to My Health record, and there's a bit of a mix of some pathology organisations will automatically upload, but some, such as those that are such as Australian Clinical Labs or Sonic Pathology brands, Sonic Pathology, they require a phone call from the practice to say, we'd like our pathology reports to go up. In effect, the practice needs to tell the pathology company that you'd like to see it go up in order for them to flick a switch and to set you up for allowing the pathology reports from your organization to automatically go up from their lab. So if you're not sure about that, if you've got questions, either reach out to us or to your local primary health network, who will support you with that process. On GPs, you can have automatic uploads of prescription information. That just needs to be set up for each individual prescriber in the practice. And if you're not sure about that, talk to your software provider. But other than that, it's a manual upload of GP shared health summaries or event summaries.
Thank you, Carey. I've got another question here, and then I'm going to ask Karen to comment about COVID-19 vaccine. So you can get ready for that one, Karen. This next comment is from a nurse. One of the roles is to educate patients regarding My Health Record. And so many patients still don't have knowledge about it, and they have concerns regarding data security. The nurse is asked to try and upload more health summaries each week, but feels pressured to educate the patients in a short amount of allocated time. So time is an issue, patients understanding My Health Record and having concerns about data security.
Yep. So My Health Record's managed at the best security measures. In 8 years of its operation, there has been 0 successful hacks. So please tell your patient there's never been a hack in 8 years, which is an excellent achievement and expected to continue. If there was ever a breach or a break-in, then there is the law, including My Health Record legislation. Just like we call the cops if someone was to burgle, we've got a legislation and penalties apply for inadvertent or unauthorized access. So yes, please use brochures, use materials in the practice to notify patients that you're using My Health Record. Dr. Harry Nespelon, the recently deceased president of the RACGP, said that patients are noticing if their providers are not using systems like My Health Record, and they're seeing it as a mark of quality on their service. So by letting patients know you're using it, it's a mark of quality, and most patients are expecting it.
I also say to patients, it's called My Health Record because it is actually yours.
Perfect. I quite agree. Thank you both. I'm going to ask Karen now to make comment on the combined role of the Australian Immunisation Register and My Health Record as it relates to the COVID-19 vaccine. Please, Karen.
Thanks, Mark. Look, I think that the My Health Record is going to play a huge role in the tracking of the COVID vaccine. And whilst we all, hopefully all, and there's new legislation just gone through to make it mandatory that, or new requirements making it mandatory for immunisers to actually record those immunisations on air. I think that if we have a large number of people being vaccinated at the same time, there may be some patients forget, and sorry, if we access air through our links through practice to that register. But I think having that uploaded to the My Health Record, some people will be requiring 2 days.
Karen, there's a bit of a sound quality issue with your comment at the moment, but I think suffice to say that, suffice to say that uploading to My Health Record will be really important with relating to the COVID vaccine and being able to track vaccine for everybody. We can put up some information on our community of practice page that responds to that question as well, a bit in more detail. I will thank you all for joining.
Some might get it at a local council centre. some might get the next one at their GPs. It makes it harder to track. But if they've got it.
Okay, I think we'll just move to the next slide. So many of you have embraced Nurse Digest sessions and told us that you valued the short, sharp 30-minute presentations delivered by Carey and Nicola from the agency. Next slide, Carey, please. And many of you have continued the conversation on the Community of Practice platform, which we absolutely encourage you to do. So this next slide shows that APNA has a suite of resources relating to My Health Record. You can join the My Health Record Community of Practice to keep the conversation going. You can access My Health Record e-learning module, which Karen alluded to earlier, and view recordings of previous Nurse Digest sessions, which actually answers a lot of your questions as well. So the link to access all of those is found on your screen, the bottom of your screen at the moment. And also the Australian Digital Health Agency has a lot of information and support available that you can access. So you can visit the My Health Record website. Carey spoke earlier about the on-demand training that's available, and that simulates the My Health Record portal across different software products. So if you use Best Practice or Medical Director or other software products, you can actually get on and get into your software product and actually play in the sandpit so that you can work out what's going on and understand the system better. So please contact the Digital Health Agency, and there's websites and information there on the screen. I'd like to finish up also with a final quote from Karen Booth, our president, who has made in a previous Nurse Digest session that My Health Record is a great safety tool and facilitates continuity of care between providers. And I think that that's actually really the crucial message that to get best patient outcomes. So thank you to all our panelists and everyone who joined this final Nurse Digest session for 2020. We hope you now have the necessary tools to start using or to continue using the My Health Record system. And we look forward to continuing to support you as best we can. So thank you, Helen, Carey, and Karen, and stay well, everybody. Bye for now.
Thank you.
Thank you.